Hey guys! So my name is Elise Warren, and I am a registered nurse here at CMC Main Hospital in Charlotte. I have been a nurse for about 7 years. My background is cardiac, so when I graduated nursing school, I got a job on a cardiac telemetry unit, also a med-surg unit. It was kind of a combined unit. So we took care of patients who may have recently had a heart attack or came in with chest pain or had known congestive heart failure, that kind of thing. I took care of post-surgical patients, cancer patients, sickle cell crisis, you name it. Med-surg is a little bit of everything. And then the cardiac piece is basically we hook them up to a heart monitor and we monitor everything going on with their heart while they're there as well. So that's my background, and I started at CMC Mercy, and I was there for 6 years. Worked on the floor, and then I was also clinical supervisor for about a year. So 5 years as a bedside nurse, and then I took a year position as the clinical supervisor on night shift. And then after I had my son, I actually took a office type position here at CMC Main with the pre-anesthesia clinic. So what that means is basically I talk to patients all day. I call them at their house and talk with them about their health history, their medications, what type of surgery they're going to be coming in for, kind of get a good background history on the patient to make sure that they're safe, number one, to be put under anesthesia, because anesthesia can actually be very taxing on your organs, your heart, your lungs specifically. So we want to make sure that you're healthy enough to be put to sleep to then have surgery. So that's kind of my job, is to do a preliminary screening. If there's some red flags that come up, I send it over to the actual anesthesiologist, so the actual doctor who's going to be administering the medicine to put them to sleep, and talk with the doctor. And if they feel like they're not safe, or they want them to go see their heart doctor or cardiologist or their pulmonologist or their lung doctor, they'll contact the surgeon and tell them, your patient needs to go be seen first before they can be put to sleep for under anesthesia. So that's currently my role, but more recently, given the global COVID-19 pandemic, I've been reassigned to screen all teammates coming into the hospital before their shift for COVID-19 symptoms. So they've pulled me kind of from my office job to be sort of pseudo on the front lines. So every hospital employee that comes in, whether it be EVS or environmental services, cafeteria workers, the nurses, the doctors, the surgeons, the maintenance, anybody that works here, I basically get their temperature upon entry into the hospital. I go through a series of questions with them, based general symptoms. Have you had any cough, shortness of breath, fevers, body aches, diarrhea, loss of taste or smell, which are actually some of the newer COVID-19 symptoms that have come up. And if they say yes to any of those questions, or if they have a fever that they may have not known about, they're not allowed to come to work, and they have to report to teammate health. So that's been my new role in the past couple months, given what's going on with COVID-19. As far as nursing, I love what I do. It's very flexible. As you can see, just in the the lifespan of a nurse, 7 years is not that long, but I've done a variety of different things, and there's still so many other things and opportunities that I can do and that you guys can do if you're interested in nursing. If you like that hands-on care, you could get a hospital type job where you can take care of patients that may have just had surgeries, or who may have cancer, or you name it, all kind of things. You can get that hands-on emergency room experience if you want, or if you're not really nursing, for the most part, you have to be a people person. But if you're not a people person, there's still roles for you there too. A lot of OR nurses, they take care of the patient once they've been put to sleep, and they don't necessarily have to really talk or interact with them. And so if you like the biology and the health side of things, but not necessarily the social piece, there's something there for you too. If you're really good with research, there's nurses that do clinical research and trials. There's nurses that work in doctor's offices, that work for insurance companies, nurses in the military. We have Med Center Air here at CMC Maine that they actually, fly in the helicopters and go pick up patients, or they also have the ground group that they travel, in ambulances and go pick up patients and transport them, critically ill patients that way. So, if you want something high energy, there's something there for you, or you like that kind of dangerous aspect of things, there's something there for you as well. Nursing is, as far as financially rewarding, is something that you can go to school for about 2 to 2.5 years, but I'd say maybe 3, including your prerequisite courses that you need to take, and you can come out and be a registered nurse. CPCC has an awesome program, as well as I'm a CCHS, or Carolina's College of Health Sciences graduate, which is affiliated with the hospital system, and they're considered a 2-year program as well, but that's nursing courses directly, not considering your prereqs and stuff that you would have to take too. So usually it's about a 3-year track to get your become a registered nurse. There's also, if you want to get your bachelor's, you could go to a 4-year university. UNC Charlotte has a great program. I actually have a bachelor's degree from UNC Chapel Hill, not in nursing but in psychology, because nursing for me is actually a second career. So I love what I do. If you love kids, pediatrics, you could go into pediatric nursing as well. I mean, really, your options are wide open as far as nursing is concerned. To speak to kind of what's going on now for the nurses who do work in a hospital setting, it is challenging. I personally don't take care of patients with COVID-19, but I know nurses who do, and it's been hard, to be honest with you, especially the nurses that work in the ICUs for some of the patients who are critically ill. That's been very challenging because as of right now, no visitors are allowed in the hospital right now. So you have nurses dealing with patients who don't have their family there when they're, in their darkest hour. And some patients, as you all know, they don't make it. And you're having to FaceTime with the families and, having to do that as a nurse it's challenging. It's really hard sometimes. But that's a part of it too. And so we need people who are compassionate, who really have, a burning desire to help people. And then going back to the financial piece, it is financially rewarding. Most times when you first graduate, you'll come out making about $40,000 to $45,000 on the lower end, and then it kind of goes up from there depending on what you specialize in, or how many hours you work, or what region you're in. I mean, there's nurses that make well over $100,000 a year. So I would say, look to come out making at least about $45,000 at least. As a nurse, I wouldn't accept anything less than that personally, and then it kind of goes up from there. Other than that, I mean, I am definitely here to answer any questions that you guys may have about nursing. If you want to get give Miss Anderson, I can give her my contact information so you can reach out to me, and I'll definitely be here to answer any questions you guys may have. And I'd love to help you in your journey on becoming a nurse if that's something that you're interested in. Thank you so much. Y'all take care. Stay safe out there. Stay home. Stay safe. Take care. Bye.